Welcome back to Plastic Surgery Untold, greatest podcast in the world as voted by us. We're talking all about the weight loss revolution today. We got our dream team here. Obviously, Nurse Sarah, who's been crushing it. And any of you who've been following her in the world know that she's TikTok famous now. So super excited that she can make a little time for us. Dr. Chang has been leading our wellness era stuff. And so, great to have them because right now, as many of our patients have been on the weight loss revolution, many more just starting, but kind of want to give people an update of where you kind of transition to. We'll give you guys a little update of where Sarah and I am. And so, Dr. Chang, you and I have developed something that we'd call the maintenance phase of this. And I think for a lot of patients, the question's like, how long am I going to be on the semaglutide, tirzepatide, the skinny shot? Then what happens, kind of my next step? And that's one of the most common. We developed a maintenance phase step. And maybe you can jump into a little bit of kind of what's the natural course. And we're actually going to share some stuff. I actually drew out, and I'll share with you guys coming soon, kind of what my progression has been over the last year and a half or so about at this point. Maybe we'll talk Nurse Sarah into doing it as well, because I think it is super interesting to be realistic about what that journey looks like.
Exactly. So, again, we love the skinny shot, and we've been doing this now for a little while, so have accumulated a little bit of practice experience, which has been nice. And it mostly supports a lot of the data that we saw even before the skinny shots came out. So what we see quite often now is as people are kind of progressing through their journey, clearly everyone's coming in from just a slightly different starting point, slightly different goal point. Our goal, of course, with osteoplastic surgeon is just to help you to get to your goal and to do that safely and as efficiently as we can. And so just, on sort of with that context in mind, everyone does have a slightly different journey, although we do try to keep it fairly consistent in terms of the experience across different patients. And then as we get you there and we get you to your goal, whether that's a weight loss goal or a size goal or a medical goal, whatnot, then we start talking about what does it look like to go on to the next part of that. So we are kind of delineating that between basically the treatment phase versus the maintenance phase now, as you mentioned. And maintenance, honestly, can be just a little bit variable from person to person, but the overarching goal, again, is to have ongoing support with the skinny shot medication. And to your question about, what does that look like? Well, it can be, you might be doing maintenance for just a few months if you just want that ongoing support. It can be all the way up to lifelong maintenance, right? And this has really been a kind of a profound part of the conversation, I feel. We know that these medications are really good and have lots and lots of benefits long term. And so, we're here to kind of help support that process.
I mean, there hasn't been a medication that's been this impactful in the healthcare system since penicillin.
No, totally.
I mean, and the interesting part about this, I feel like how long and how much of the semaglutide, tirzepatide, the GLP medications people want to be in is going to be an evolving effect, because if you've seen, the FDA recently approved in patients who are overweight or obese, the semaglutide is actually a preventative medication for coronary artery disease, stroke, heart disease. And so there may be a time when sort of like a statin or other medications that you actually want to keep people on a low dose just for cardioprotective, which is a real possibility by how quickly the FDA approved it for that prevention of that disease.
Absolutely.
So I think there's I'll tell you my personal story. Maybe we can jump into Sarah as well. But, over the course of the year, I lost about 85 pounds, and then I slowly decreased over a series of months my dosage in terms of that to get to a good spot. Because the idea is, remember, this only works in terms of getting off the medication is if you're using it as a jumpstart to make lifestyle changes. The idea is that you're using this to jumpstart, to making those changes easier, so you're not overly hungry, you're not starving. So it just kind of tweaks some of that. And most of the time, we tell everybody, making lifestyle changes at the same time is critical to your overall long-term success. And then, we follow you over that time to making sure that you're making progress as you're decreasing those doses. Is there some people who can't decrease their dose? Absolutely. Most people can to some degree. And most people, once you get to a good goal weight, just need a little something to help that, especially if you're cognizant of why. A lot of us, like myself, tend to emotionally eat. And so if you know that there are stressors, life changes, whether those could be jobs, relationships, families, unfortunately, deaths, divorces, things like that can trigger some of this. So I think being super, super mindful. I'll get into a second my specifics, but maybe Nurse Sarah can tell a little bit about her journey, because we started actually about the same time. She reached her goal a little bit faster, which is super common. You can't compare. Everybody has a different starting point, but has been able to maintain a fit and fabulous spot pretty well.
Yeah, this is one of my favorite topics because we love getting people to their weight loss goal, right? That is so fun as providers. So, and obviously for me, that was super fun. So, I agree. We started about the same time, about a year and a half. I lost about 40 pounds. So obviously hit that a little bit faster, but, was super excited to be there. What I love about our practice that I think really sets us apart is we'll really customize that plan for you. So for us, we were kind of figuring out what we wanted to do, right? And taking our time, seeing how hungry we were, if I wanted to stay on, if I wanted to decrease. So I didn't get up to the max dose of the medication. And I think that's, an important point. You don't necessarily have to get to that max dose to get to your weight loss goal. Everyone's different. And that's why it's so important to check in with your provider every month about your dose, see how you're feeling. If, you're getting to the point where you are getting too used to it and maybe we need to up you a little bit to keep, keep the progress going. For me, I only got up to about the third tier. I stayed there until I hit my goal. And then I decreased down one dose each month, but I did it pretty slowly. And then at the end, I stayed on that low dose and even got to the point where I was kind of doing every other week, which is one of our options now on that maintenance phase. And then, like Dr. Franco said, it's all about the lifestyle changes. So I tried to be really good about continuing to eat smaller portions.
I did see that you started your Pilates body phase of workout last week. So
you guys,
congratulations.
Thank you. It's only taken me 2 years since my tummy tuck. I'm finally back into the workout routine here, guys. And that's obviously so important to continue to maintain. But like Dr. Franco said, there's stressors and there's like stages of life. So I decreased down. I was able to successfully be off of the medication for a while. But if you find yourself like me around the holidays, I was like, I want to get back on. And now we're getting into summer. So I personally have myself gotten back on the maintenance phase, just a low dose every other week to kind of keep myself in check, help with the hunger noise and all of that. And it's really, and then getting back in the workout routine to really get ready for summer.
I just don't want people to get confused because there's a couple different parts to this, right? So there's the initial ramp up phase where we start people at a low dose. Everybody's a little bit different. I felt an effect right away. My brothers, when they started this, had to get to a higher dose to get an effect. Everybody's a little bit different. So there's the ramp up. We get you to a good spot where you're losing weight at a good steady state stuff. Everybody has a different goal. So that how long you're on that kind of, hardcore phase of really trying to lose weight is going to be variable depending on where you're starting, where your goal is. And then once you get to your goal weight, it's not like we automatically transition you to maintenance because that's not true. So what happens is, we hold you at a good spot for a while and then slowly decrease you because just like anything else, you want to transition in a very methodical way to make sure that you're doing great. And that's why we have you coming back every month. That's why we're having you weight check in and then making sure that you get to a good spot. Once you get to a great spot and you've been able to hold that for a while, then we transition you to a maintenance phase. And so this is why I think going to a provider that truly cares, that has lived this, is priceless because we want to make sure that we set you up for success. And the whole maintenance idea is, I don't think people realize the reason right now that you can do a weekly shot is the half-life of the medication is actually pretty long. So it's about seven days. And that means you still have the medication and then slowly it goes down. Most people just need a little something in your system. And that's why you can tweak with some of these microdosing just to help with a little bit of the hunger cravings, but getting you back into a good spot. So I want to be super clear to that whole roadmap and maybe something we can talk about one of these weeks and actually draw this out for people because I think that would be helpful.
Yeah, would love to.
Talk about us in terms of maintenance phase because you said you do an every other week shot stuff. Do you feel like that's helped with your hunger cravings and so forth?
Yeah, absolutely. And especially, sometimes our patients love to spoil us at work. We get all the, treats and everything, and we love that. So for me, it's really helpful. I do one of the starting doses, so just one of the low doses of the semaglutide every other week. And it's enough, just like Dr. Franco said, just to kind of keep the cravings in check and make sure I'm behaving, especially, at a time in our life when we're super busy and, school and kids and work and all of the things. So it helps to not have to think so much about it, which for me is really, really helpful and has also I want to get ready for summer. We got that pool party coming.
Yeah. And I think just so people know, we developed this maintenance phase because, we want to make this super affordable. We want to make this super attainable for everyone that's been on their Fit and Fabulous journey. And that's why we've worked really, really hard with some of our industry partners to try and get something that's super obtainable for patients.
Exactly. And I love actually having that conversation because it is a little bit of a give back, so to speak. And I think our patients totally appreciate it. So we have we've been doing this for a little while now. So we do have a reasonable number of people who are already on maintenance, just like yourselves. And and I think every time I have that conversation, our patients are just so appreciative. I mean, they love the fact that we're able to provide that for them, and you know, of course, maintain that relationship, continue those conversations going, so that we can help with even that part of the process.
Yeah. And the other point I'd like to make is it's so much better for your body to maintain a stable weight than to yo-yo diet.
Exactly.
Especially with like skin laxity, which has become such a common thing. And I know we'll talk about that in an episode coming up. So if you feel like you hit your goal and you weaned off and you see yourself starting to creep back up, then get back in before it gets too far, because it's so much better for you to maintain than go up and down and up and down. And then you've got your skin laxity is so much worse as well.
We just don't bounce back. I think Kevin and I both have had some back issues recently, and people ask, why does your back hurt? I said, it's the day that ends in Y. And so, you know, it's just one of those things. So 100% our skin does not bounce back like it used to. The yo-yoing is horrible. But also I tell people, when you're in this process, kind of know what your triggers are. You know, if you're someone that eats with stress, if you're someone that's going through a difficult time stuff, and that tends to be your outlet, you know, be mindful of those. Where, you know, even if you left us and you need to come back with no hard feeling stuff,
Exactly.
we definitely want
to see you.
Love to see you. Definitely want to help you, just because it's something that does. I mean, I'm someone that eats my stressors. I know that. And so this has been super helpful. When I'm going to go visit my family, I definitely do a shot before I go. You know, I've continued to do some of the, and we'll get into this as just kind of a little bit of teaser, but part of that maintenance phase has also been, you know, kind of the fitness phase. So, you know, muscle building. I've continued my B12 shots, you know, trying to make sure that increasing that diet type stuff things. And then we'll get into kind of our next episode as well, because there's so many new things, but some of the labs and hormone balance stuff. So I think as we've had people transition to that maintenance, they've been more self-aware of their overall kind of health. And I think that's super important to make sure that you're taking care of yourself in all aspects.
Exactly.
Absolutely.
Yep.
Awesome. Well, appreciate it. Just wanted to explain a little bit about what maintenance phase actually is, because I think some people have been confused, but also super excited about being able to help people through the long-term journey here, because I think this is still going to evolve. I think you're going to see some people who are at high risk for other
absolutely
medical issues and diseases that are going to need this and truly benefit from this. And I think you're going to see it just like other medications, where it's actually being used in a preventative nature. So super excited. Appreciate you guys taking some time. Plastic Surgery Untold, greatest podcast in the world, is voted by us. Get us anywhere you get your favorite podcast, Spotify, iTunes. And if you want to see us, because I think Sarah and I are actually matching a little pink stuff
Spring
here.
colors.
You can watch us on YouTube. We'll see you guys soon. Bye.
Bye.